Hey everybody, I get a lot of questions about should I get an MRI, should I not, especially for the shoulder. So, a couple of things that go into this, I typically say you don't need an MRI yet. And most insurances will say you need to do 6 weeks of therapy first before you get an MRI for a shoulder injury. And the reason for that is they find that the physical therapy gets rid of the pain and the problem, and it's cheaper to do physical therapy than it is for an MRI for both you and the insurance company. So they want you to go through that conservative treatment first because the majority of the time it works. So, what kinds of things make it so that you need an MRI? So, what physical therapists, physicians, surgeons, they start thinking about are, was there trauma in the area? Did you get in a car accident? Did you fall? How much swelling is in the area in the shoulder? What kinds of things can you do? What kinds of things can't you do? Do you have motion? Do you not have motion? Do you have strength or is it weak? These are all things that go into thinking about, do I need an MRI? So an MRI helps to diagnose connective tissue disorders. So that's different than an X-ray, which helps with bony problems. So bone problems like a broken bone, also known as a fracture, or arthritis. You can see those on the X-ray. MRI helps with ligament problems, tendon problems, muscle problems. It can see some bone kind of problems and joint space changes, so also some arthritis, but you can see those on X-ray better. So if you have a torn ligament, if you have a torn tendon or a torn muscle, yes, those show up on MRI. A lot of people think, oh, okay, well, I think I have a rotator cuff problem in my shoulder. I need an MRI to diagnose that. That's not necessarily the case. So a physical therapist or another physician can diagnose a rotator cuff injury by doing a physical exam. So in our shoulder, we have different kinds of connective tissue. We have fat, we have ligaments, tendons, which are a part of the muscle, and then we have cartilage and labrum. So when a physical therapist like me takes your arm through a motion, I'm thinking to myself, does this have full motion? And is it full compared to the other side? Is it painful when the patient moves it? Is it painful when I move it? If it's painful when you as the patient moves it, and so you don't have full motion there, but I can move it and it doesn't have pain and there's full motion, okay, so now we're thinking tendon or muscle injury because when you've activated that muscle and tried to move the arm, that creates pain. So if you have full motion when I take it through and no pain, okay, now we're thinking tendon or muscle. Now we do different motions to see, can we change position so that you have full motion and less pain? So maybe you're standing and you go to move your arm forward like this, or more likely out to the side like this, and that one hurts. So what happens if I have you lay down and do that, or sit and do that, or lay on your side and do that? Does that change how the pain is? So these different things can make it so that, okay, if you can do it, it's not a full tear. If you can do it in any of those positions, not a full tear. If the fibers are torn a little bit so that it creates some pain when you're doing the motion, but you can get through, you can suffer through it and get through that full motion, we know that it's not likely to be completely torn because the muscles wouldn't be able to pull and contract to make the arm move that full motion. So many people have pain with this out to the side. I call it the half jumping jack motion. And they'll say, okay, it's good, it's good, it's good. Oh, now it hurts, now it hurts, now it hurts. Oh, now it doesn't hurt anymore. So that is called the painful arc sign. So I'm moving my arm in that arc, and between about 90 to 100 degrees of that motion, 90 and 120 degrees of that motion is where your rotator cuff muscles, the bursa, and some other tissue gets pinched. Well, what if I take it through the motion and it's not getting pinched as much, and we can take it through that whole motion without as much pain? So these are instances where you wouldn't necessarily need that MRI because we've found a way to make it so that you can still stretch and move that shoulder with less pain and to get it through that full motion. So if we can continue to practice that, we'll calm down any inflammation that's in the area continuing that pain and not have to do the MRI. If we can't find any relief position, if we can't find any way to get that shoulder moving, then yeah, maybe we consider that MRI because we want to make sure that we can get you better as soon as possible. And that involves doing motions and exercises to alleviate the pain and strengthen the muscles. If you have other conditions where you have no motion, I can't move it through the motion, you can't move it through the motion, and it's stuck, well, you probably don't need an MRI for that either because you probably have a frozen shoulder and the MRI is going to come back normal. The x-ray is going to come back normal. But if you have limited, especially external rotation, where you have your elbow bent to your side and move that hand out to the side, if I can't move it through that motion, you can't move it through that motion, and it's stuck, it's locked up, probably a frozen shoulder. There are other motions that will be limited as well, but that's the biggest telltale for frozen shoulder is that external rotation. But an MRI is not going to show anything. Most people should do therapy first. The MRI, it's a fancy selfie. It's an expensive selfie. Sometimes it doesn't show anything. Sometimes it says, oh, well, maybe there is something torn. But if you ever get an MRI or an x-ray, at the bottom of the report, it always says, compared to clinical findings. So they're always comparing it to what the physician or physical therapist finds on that physical exam, because you can see some tears or some arthritis or some changes, but it doesn't necessarily mean it's related to the problem at hand.